Alright guys, so here's a quick review of the pharmacology final study guide that we're going to be doing for our exam, for our final exam this week. So definitely know the drugs, Lipitor, right, what it's used for, the classification, the teaching that is required for it, any contraindications or signs and symptoms and side effects. Albuterol, right, for the respiratory system, metoprolol, lisinopril, Lasix, Vasotec, Ativan, digoxin, phenobarbital, aldactone, epinephrine, and morphine. Know how drugs are metabolized, absorbed, and distributed in the body. So if you remember back in the first and second week about pharmacokinetics and in pharmacology, pharmacodynamics as well. Definitely no age considerations for administration of medications, such as the children and elderly. So that would be anything from the difference in pharmacokinetics from a child to an elderly person. What would you assume? Definitely remember your table for the concentration, as well as the therapeutic level, the toxic level, onset, peak, and duration, and what those things look like. How do we know how often to give a particular medication? So if, for example, our elderly patient with a liver issue, what would you want to do with pharmacokinetics that would put them at risk for toxicity? Same thing with renal. So know the first pass effect, what that is, where it happens, and what it means. What routes go through the first pass effect versus those who do not go through the first pass effect. We're going to have a couple questions on the pregnancy risk categories, as well as the FDA drug schedules and examples of what drugs are on what schedule. So if you remember schedules 1 through 5, as far as what the difference is between each schedule, and what the drug schedule even means to begin with. No, I think I went over that already. Pharmacodynamics and pharmacokinetics. Renal function and drug metabolism, kind of talked a little bit about that. So what you would do with regard to renal function, having to do with metabolism, always remembering that excretion happens most often in the kidneys. The MAO inhibitor, know what it is, what we're treating the patient for when we give one of them, as well as what foods to avoid that contain tyramine, such as aged cheeses, wines, and aged meats and things like that. Side effects of opioids, right? What are the biggest things we're looking for side effects for opioids, as well as NSAIDs, as well as what their reversal agents are if they do have one, right? So of course we've talked about NSAIDs the entire class. So know what the side effects are, so GI side effects, right, as well as cardiac, and what you would do to be able to treat it. Opioids especially, definitely know the reversal agent and what it does. So its classification, if there's teaching required, what its use is for, and if there's any contraindications to that medication. Know tamoxifen, what it is and how it works, and why we would give tamoxifen. And then what we're really going to concentrate are these last couple things is going to be the highest concentration. So definitely know the difference between your type 1 and your type 2 diabetes, what the signs and symptoms are, why they're having those specific signs and symptoms. If you remember the 3 P's of diabetes, so you're going to need to understand more of the pathophysiology of what is causing or why the person is showing those signs and symptoms of the 3 P's. Know about your biguanides, and glucophage, glyburide, and really just your oral anti-diabetic. So don't concentrate too much on the glucophage and glyburide, but just your oral anti-diabetics, which were the sulfonylureas, your biguanides, meglitinides, and then the thiazos. let's see, I put that twice. No basics about insulin administration. So we've talked about which one is cloudy versus which ones are clear. Know which ones you can mix in the same syringe versus not mix at all. Know when you can give certain insulins and what the teaching would be required for the patient receiving that. So if a patient's receiving NPH, what is some important teaching that you'd have to give to them versus someone who's getting a rapid acting versus someone who's getting a long acting. So what are treatments and nursing considerations and patient education with all of those insulins? It's going to require a little bit of critical thinking, kind of like we saw in the group quiz this past week. Know the autonomic nervous system. Information, what types of drugs stimulate it or block it. So you're going to have to remember the autonomic nervous system, parasympathetic versus sympathetic, what happens within the body by system, just like we went over during the first few weeks with the nervous system. You're definitely going to want to know those things. And then we also have here Coumadin, right? So we want to know what its antidote is, what tests you would use to monitor the drug's effects, as well as what specific diet or patient education you would give regarding the diet when a patient is taking that medication. And what are signs and symptoms of adverse effects as well that you want to let the patient know to let you know if they're having them. Definitely know the tonicity of fluids, so isotonic, hypertonic, hypotonic, when you would give each one, what those electrolyte shifts would be between intracellular and extracellular spaces. Know hypothyroid and hyperthyroidism concepts, so signs and symptoms of each, what their treatments would be, what the side effects of each one is of the medications that you might give. Which ones you can give IV versus not, as well as education with that. What would you want to educate your patient with? Anything we've gone over technically up until this point is fair game, but most of the concentration will definitely be on, as you can see, probably about just under a half of this study guide has to do with the last lecture that we had. So tamoxifen, type 1 and type 2 diabetes, oral anti-diabetics, as well as insulins, the administration, tonicity, hypo and hyperthyroidism, all of those concepts will definitely be the bulk of your final. Okay, so we'll definitely have a review when we get to the final on this next week, and then we'll take the exam. And then after the exam, I will grade your guys' exams. We'll go over it briefly, and we'll probably only have time to go over the ones that majority missed, and then be dismissed from there.